Right, very uncertain moments for the world at least, and of course these are times that require a lot of concerted efforts in all ways as far as dealing or combating the coronavirus is concerned. Hello there, welcome to this edition of Youth Connect, coming to you live from our headquarters right here in Nairobi. My name as always is Eugene Anangwe. Now tonight on the program we'll be putting on the table one of the major areas that we need to really discuss, and that is the lessons that we are drawing from the coronavirus pandemic. What lessons have you learned? What is it that you have been able to actually change as far as your lifestyle is concerned, as far as this particular virus is concerned? We'd love you to talk to us. And what are some of those measures that have been taken right now, announced by the government and other institutions, that you would love to stay on even after this particular pandemic is long gone? We'd love to hear from you. Share your thoughts with us. And of course, in the program, we'll be sampling some of the short videos that have been sent to us by several people from across the country. Also in the program, we'll definitely be able to have an in-depth discussion around this particular issue. All you need to do is tweet us and use the hashtag YouthConnect. Right in the program, we've been able to make sure that we respect the social distance issue right here. And of course, I'll be introducing our panelists in the studio. Some of them are right here in this particular studio, and the others are located in our other different studios. And let me start off by introducing Dr. Ida Wanjiko, who's a medical doctor. Thank you so much for making time and joining us in this particular program. Very, very trying times right here, but of course you'll be giving us insights on this particular issue, how we deal with it. So if you have questions for Daktari, please start tweeting. Hashtag is Youth Connect. Also with us in the program is Kenneth Oyola, who's actually the Chief Commercial Officer of Jumia Kenya. We understand that there's a boom in delivery services, and of course we'll be talking a bit about what Jumia is doing to ensure that whatever they deliver to you is actually still safe. Also with us in the program is Brad Osumo. His very first time, actually, he said earlier on television, and of course on a magnitude like this one, and he's the founder of The Big Fish. If you love fish, he's definitely probably has delivered fish for you from The Big Fish. Thank you so much for joining us on this particular program. Thank you so much. Now, let's kick off this particular conversation. I want to start off with Daktari right about now. And the first question that I have here is from a medical perspective, as a country, did we see the signs? Could we have avoided what we are seeing today as a country? Let's start first of all from there.
All right, thank you so much, Eugene, and it's lovely to be here. So did we see this coming? Of course we heard about it because it started in China, then of course went to India, there's Italy, there's the US. So yes, we did see this coming. And I think we were hopeful it wouldn't get to Kenya, but unfortunately it is here with us. And we actually have, I would want to commend the Ministry of Health and the government, because it has emphasized continually to put in measures of hand washing, of sanitizing, of keeping social distance, staying at home if you can work at home. So we have some measures put in place. And so perhaps it would be a challenge to the Kenyan, my country people, our Kenyan people, to actually put these things that have been said to action.
Right, and this is what you say, that we may have seen this coming. We may have actually done better. And of course, Daktari is commending the ministry and all those who are dealing with this. But let me bring you in, Oyola, from Jumia Kenya. I want to read your thoughts on this. Do you also agree that we could have done better to actually avoid what we are seeing today as a country?
Thanks, Eugene. Whilst I wouldn't comment on whether we did better or not, I think what we are seeing is with the pandemic, it's spreading not only in Africa, but in other countries. I think I must say that I would commend the government for the efforts that they have made. But I think it's not just about the government. There's been a lot of information to different people, to all of us as citizens, to do the right thing. So personally for me, it's my second weekend of quarantining with my kids. And my first week of working from home while still connecting with my teams and doing what is right, I think there's a bit of a personal responsibility.
Still at it. I mean, just talk to us a bit about the experience of actually staying home. We all understand that in the past, we've all been telling people, go out there and work. Go out there and do something for yourself. And this time it's a reverse of it. Stay home, don't work, don't go to work. How's the experience been for you?
I think for me and as a Jumia, as an employee of Jumia, the one thing is we are taking very seriously the health and safety of our colleagues, our vendors, our partners. So and we keep on relooking at how the situation presents itself. And coming from last week, a bunch of us have started working from home and leveraging technology. So I've lost count of the number of Google chats I've had to jump onto. I think on one side it's also been, there's an excitement around it in that literally seeing what technology can be able to do for you on one side. But on the other side is also kind of just adapting to the reality. We are a humble and agile company, and for me that has been, it's been a different experience. Of course, we got teams who are still working very closely to make sure that we're keeping the highest health and safety requirements, like contactless delivery. We stopped receiving cash on our platform from some point last week, and we're encouraging our consumers to use methods which are contactless, like using Jumia Pay or using M-Pesa or all other options. So it's been an interesting and a different place that we are in, and we're taking it as it comes and evolving, and also taking a long view of it and not just a short view.
Stay with us. Let me now bring in Brad. Brad, say something. I know your fans are watching. They've been actually cheering you on along the way. Of course, when we posted that particular tweet that you'll be on the show. How has this thing changed the way you do business? Has it changed for better, or it has really messed you up as a person who's been delivering those, yummy delicacies as far as fish is concerned?
First of all, Eugene, I wouldn't blame anyone. I wouldn't even blame the government on anything. It's a natural disaster. I think coronavirus, it's a natural thing. So it has affected everyone, like all over the world. But personally, as a business person, I think it has brought negativity. It has brought a negative effect. The jam, the traffic that was there before, it has gone down, possibly because of the scare. People are scared that maybe they would contract the virus, or also the government said that we should keep the distance, the social distance. So everyone, most people are remaining at home, and it's bad.
Brad, before I let you go, I mean, some people would assume that those who have employed service delivery, as far as their services are concerned or their strategies are concerned, would be actually smiling all the way to the bank, maybe not literally going to that particular bank physically, but they would be celebrating, because right now those people who are just relying on physical delivery of their services are the ones who probably would be suffering more, as opposed to people like you who are doing deliveries.
Not really. When such a thing occurs, everyone is scared. Whether you're delivering or you're not delivering, everybody is scared. Though I would say the guys doing the delivery are lucky, or not lucky, but they're in a better position than most guys who don't deliver, because at least they would still be in the business. But I wouldn't say that the business is booming, because when everybody is scared, not many people also tend to ask for delivery, because they're also scared. What if the delivery guy or the delivery person has the virus, or everyone is just trying to minimize contact. I don't think anyone is happier, or anyone's business is booming.
Kenneth, I'll come to you, just digest that particular question, which I'll definitely be able to expect some feedback from you on the same. But let me bring this back here to Daktari. Dr. We seem to all be scared, of course, when it comes to the sound or the thought of coronavirus. Anybody sneezing, even if it's just an innocent sneeze, everybody just turns and is like, okay, I need to really be far, far away from this particular person. But just take us through how bad this thing is. I mean, from where you sit.
All right. So I actually recognize that we are all anxious. And some are fearful. And I'll start by saying that please do not fear. We are not given a spirit of fear, so please do not fear. Yes, anxiety is good because I say anxiety can spur you into action, but fear will actually paralyze you. So please, first of all, Kenyans, don't fear. Don't fear. Just try to do what the health professionals out there, the Ministry of Health, anybody who's out there telling you to do, just do it. That's number one. And then how bad is it? Well, I will quote what our CS, Ministry of Health, Honorable Mutahi Kagwe has just said earlier today in the brief, that we now have 15 confirmed cases and we need to continue isolating more. So that is actually what we have on the ground as of now. Exactly what the CS, Honorable Mutahi Kagwe has said. So we have 15 confirmed cases. Thankfully, we have not lost anybody, and we are grateful for that. And so this is just a message coming from a health professional to tell you, do not fear, have hope. Please have hope. And if you have any flu-like symptoms, we have the helpline number that you can call. We even have, I think even the government, the Ministry of Health has gone a step higher in getting a WhatsApp, something that you can do. I think you do *719# and it gives you the options that you'd want to take. So, I mean, the information is out there. Please don't have stigma. This is not something that anybody would want to have. So let's not have any stigmatization of any form or kind. And if you have any flu-like symptoms, we have the numbers that you can call, and then you will be directed on how to get isolated. We even have coronavirus scoring system, where if you score between 0 to 3, then perhaps you're safe. Between 3 to 5, then that means you need to do serious self-quarantine, and above 5, a score of 5 and above, then that would mean that you'd need to, get isolated in a hospital and get the treatment.
Yeah. Maybe, Dr. when you say that we should not fear, some people have taken this in two ways. Let me first address the first way. Someone says this is what is encouraging people to actually, continue with their day-to-day normal activities, including those who are used to going to the clubs. Now we've gotten measures whereby now even these clubs have been ordered to be shut down completely. This call for people not to fear, continue with life as normal, could it be one of the reasons why people have taken this particular directive lightly?
I'd want to say that unfortunately, coronavirus has come to Kenya to make business not be as usual. You will be inconvenienced, unfortunately. Some of your businesses may be affected. If, for example, like our friend who is selling fish, and right now he's actually saying that the business has gone down. So coronavirus will inconvenience you, but it's only for a short time. We are hopeful that we are able to isolate the people that we can, get them treated, and within no time we are hopeful that we'll go back to where we were. But I'd like to say that Kenyans, this is not a joke. This is not a joke. It's exactly what Honorable CS Mutahi Kagwe has said. Let's take the measures seriously. And I like that he has also incorporated the police. There's also that, he's also talked about people being jailed, I think for 30 days, if you don't follow the quarantine process. I mean, he's also said that by Wednesday, there will be no people coming in or out of the country. So let us please follow this, It's only for a short time, and hopefully the pandemic passes Kenya and we go back to normal. But as at now, it is not business as usual.
It is not business as usual. Let me bring you, Kenneth, back on this particular conversation. When you hear what Dr. is saying, do you feel that we need to actually tell Kenyans that this is actually beyond what we think we can handle, because throughout the day there was a trend that was actually trending. There was a hashtag that was trending, ignorant Kenyans. What do we need to do to make fellow Kenyans understand the magnitude of what we are facing as a nation now?
So, Eugene, I'm going to give you a couple of perspectives from Jumia. So if you think about what is Jumia, Jumia is about three things. We are a marketplace, we have a logistics solution, and we've got a pay solution. Now, we've been around for 8 years and we've been interwoven into common people's lives. Today, one of the things that I am seeing is that whilst before we were looking at convenience, but today and this last week, we've shifted a lot of our focus to respond to what consumers are saying. We're seeing people are looking for essentials. And why are people looking for essentials? Because I'd want to believe that they're looking for home deliveries, which we're able to do. One of the things that we implemented quite early, and in the first day, there's a little bit of a laugh whereby we were trying to do contactless delivery, whereby our delivery person would come and drop the parcel and then step back and wait for you to come out, and then he would process the payment, which is again contactless. But I think after very quickly on the second day, the vibe and the comments that we were receiving online were really, really positive. So I think to answer your question is, it is nothing, I don't think it's something that we should be able to take very lightly. We're seeing the reality, seeing what is happening in Italy, what's happening in the US, and even in Wuhan. It's about life, and we are out to preserve life. We're out to make sure for us as a business that we are making things easy. We're able to deliver to the house. We're making sure, so for example, one of the things that we've done using a global network of sourcing, we've been able to source thousands of masks that we are donating to the health segment to make sure that our people are safe. We are trying to make sure that things like the price of hand sanitizers are very affordable and not tolerating any people who are trying to do anything that's different on our platform. I hope that answers the question.
While you're still at it, Kenneth, probably you can break it down to us. What does contactless mean? Because some people feel that the delivery process is a chain. And of course, from the moment someone sees that particular product online, then they make that particular order, there's a chain. There's a chain to the point where now this delivery reaches my doorstep. Just explain to us a bit about what you've been able to do that would make people feel less scared, that even the person who delivered this, as Brad was saying, is not really a risk factor to the lives of those who are receiving these deliveries.
That's a good question, Eugene. So let's look at this. One is from our vendors, because we're a marketplace, we have gone the extra length to educate our vendors about the importance of staying safe. And this they're very clear of. So from the point when the product is sitting in our warehouses, each and every Jumia person who comes into the warehouse, the first thing we're doing is we're measuring the temperature. Clear records are being kept of anybody who's delivering and being in contact with a parcel. We're making sure that our staff who are working in our warehouse have gloves and face masks and disinfecting, and we're disinfecting surfaces on a very regular basis. From then on, the riders who would be the ones delivering the product to any of our users have been really trained very, very well, and we're doing quite a lot of blind checks and checking back with consumers if they followed through this. So you'd find our rider would be having sanitizer on him, he'd be having a face mask, he would be having gloves where relevant. And then at the point when he's on his way to you, he'd inform you he's on his way to you. He's going to do a contactless delivery, meaning when he gets to your doorstep, he'll drop the parcel, he'll step 3 steps back, and he'll wait there until you come out to receive the parcel. He'll make sure that you received it, and then you're going to pay him via Jumia Pay or via M-Pesa. So throughout, from the beginning to the end, we are assuring that consumers have the peace of mind to know that the product that they're receiving, we've taken the utmost care as Jumia to make sure that it gets to them in a very safe way.
Right. Now let me bring in Brad Osumo right in before we go for a break. Brad, as a young person, I'm sure you've had a lot of stories. Of course, we've seen people who say this is just like a movie. You know, some of those movies we've seen, some of those movies we've watched. of the end times, and some people have had some conspiracy theories. Some have even termed this as possibly a war between two nations, and we are the ones who are suffering. What's your biggest worry as a young person as you watch Kenya, as you watch the world go through this coronavirus today?
I would say in my business, the restaurant parties, mostly young people, maybe we greet each other, we are happy, we are jovial when we meet, so it's easier to spread, to contact the virus, and when mostly when we meet, it's hype. There is that hype and everything. We touch each other and everything, and I think we are scared as young people, and I can say we as young people, we are not supposed to be scared because it's usual. It's a natural disaster occurs. We've seen in countries where there's tsunami and the earthquake and everything. We should not be scared because it's a natural thing, and I'm happy Daktari has said that it's something that will pass. We give it time, we give it more some time. When the government is able to contain it, it would pass, and then we'd go back to normal. So we shouldn't worry because it's something that is going to pass.
Thank you very much. Now, we're going to take a very short break now, but before we go there, there's this particular story that has been pieced together by our kid stars right here on TV47. They run a show called Sauti Yetu. They packaged this earlier on, and it has to do with what we need to do as far as lessons from the coronavirus is concerned. Let's take a look at it, and then we'll go for a break and come back to read your tweets. All you need to do is add the hashtag YouthConnect. Tell us where you are, what lessons you've learned. If you have questions for Daktari or our panelists tonight, also feel free to shoot those questions.
Fitness is a lifestyle. Going to gym every day can help improve your cardiovascular system, boost your mental health, and keep the doctor away. Most gyms are stuffy, and in the wake of coronavirus, it is advisable to exercise outside. These include biking, jogging, and dancing. Over 200,000 people have been infected by the virus all over the world, with over 10,000 already dead. Kenya has 7 confirmed cases. Most gym members have opted to embrace outdoor activities to stop the spread of the virus.
My name is Victor Odur. I run a gym called House of Sweat. Me, myself, I am a trainer. So we have closed the gym due to the directive given by the county government of Kenya due to the response of corona.
We are in a position to stop the spread of the same one by washing our hands. Number 2, I'll call it social distancing.
We've actually stopped training inside the gym. We're actually doing the outside.
We're training out here because of the coronavirus. We normally go to the gym, but now we can't.
The hygiene matters, because for example, if I'm infected, I touch a surface and you come and touch that surface. If you don't sanitize your hands, you get infected.
Actually, the reason why we are not in the gym is because training outside is good. We can keep our distance and avoid infection.
We are not taking caution only when we are training, but we are also taking caution while at home because we have sanitizers. We are encouraging washing hands.
It's logical to think that the more people touch shared objects like weights and cardio machines, the higher the risk that someone could leave behind a virus, passing it on to others. Mass gatherings are a point of concern. The World Health Organization, WHO, encourages social distancing. What does that mean? No handshakes, no hugging, and keeping a distance of at least 1 meter. Sylvia Dhiambo reporting for TV47, Nairobi.
Welcome to Woodland Resort, carefully positioned in a tranquil environment to give guests an almost private stay with the advantage of being in a serene and spoiled surroundings. We have a tailored, bespoke and transparent travel itinerary that are personalized with individual guest preference. Our well-trained, warm and friendly service personnel attend to guests, offering them fresh traditional meals sourced locally and matched with our chef's culinary skills to ensure consistent and rushes feedback from our clients. Woodland Resort, for comfort and elegance. Located in the outskirts of Kitale town, Kitale Webuye Road, opposite St. Joseph's Boys, Kitale.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the Government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Right, thank you so much for still being with us. This is Youth Connect, a program that airs every Sunday from 8 p.m. right here on TV47. My name, as always, is Eugene Nangwe. Now, tonight we're talking about what lessons are we drawing from the current coronavirus pandemic. I know probably you're now feeling choked over this particular topic, but we have to talk about it, because the moment we don't talk about it, probably we'll be able to lose out in a bigger way. We've been discussing this with our panel right here, Dr. Ida Wanjiku, who's a medical doctor. Also with us is Kenneth Oyola, who's actually the Chief Commercial Officer at Jumia Kenya, and Brad Osumo, the founder of The Big Fish. Before we went for the break, we were looking at this particular pandemic, but let's now take a look at some of the tweets that have been coming through, and all you need to do is add the hashtag YouthConnect. It makes it easier for us to track the tweets when you send them in. One of them is coming from at Ben, father of them, and he says, what will eat us is ignorance. People are just ignoring simple things like sanitizing and social distancing. Dr. Why is it that a very basic thing like just washing our hands has now ended up being one of the things that will actually save us? I mean, where were we to actually know that this is one of the things that we need to be doing?
All right, thank you for that question, and thank you for that tweet. I think it's human natural phenomenon to actually disobey, because we are disobedient. Yeah, when you're given an instruction, please just try to do it. It's for your benefit and for posterity. We would rather postpone your wedding, postpone whatever social gathering, postpone a catch-up, catching up over beer or something, but you leave. Then you do it, then we bury you. So I think it's a human natural instinct to want to rebel or to be stubborn. But I'd really ask people, please don't be stubborn.
Yeah.
Try to be governable. Just be governable. Accept to do these simple steps. And even after the coronavirus wave has passed us, we need to keep hygiene. because we are a third world country and we've always, for the longest time, been battling with cholera, diarrheal diseases, and all this is because of hygiene. So even after coronavirus, let's continue hand washing techniques and sanitization.
Yeah. What's the biggest misperception about this whole hand washing thing? Because some people have argued and said not everybody can afford the alcohol-based sanitizer. So what do we do with them?
Number one rule is regular, routine, proper hand washing techniques with running water and soap. Any type of soap, kipande soap, any type of soap. The sanitization is just coming as a supplement. But the message I'd like to pass is running water, washing your hands with running water, either from a tap or from a dispenser or something. I mean running water and soap. The sanitization is only coming to supplement. But if we can do the hand washing even without the sanitization, but we do it often, we will be at a better place.
Yeah. Maybe before I bring in Kenneth and Brad on this, there is this fear again. People pass this information and it's important to debunk it or give us the correct position on this. Some people are even worried to use the hand sanitizer, the alcohol-based sanitizer. They've been claiming that this will actually also have adverse effects on our hands. Some people even touted cancer. Is this true?
I would want to demythologize and demystify that. Alcohol is only, the alcohol-based hand sanitizers are to be able to kill any viruses that you may have contracted, because coronavirus is not airborne. It is transmitted through droplets. And these droplets, when they fall on surfaces, when they're on somebody's hands, you're doing transactions there, you've held money. So the point of these hand sanitizers, the alcohol-based hand sanitizers, is just to remove the virus. I'd want to state something, that we have not carried any tests so far to say how long the coronavirus can be able to survive on metal, on glass, on plastic. But we are using the studies that have been done before on other viruses. And that's why we are saying that, something like on wood, it can last even up to 4 days, and plastic is a few hours, on gloves. So the whole point of this hand sanitization is for the alcohol to be able to clear, because you don't know what you've touched and at what point you can contract and transmit the disease.
Yeah. Kenneth, let me bring you in on this, because if we are to take off your hat as an official or as an employee of Jumia and just remain with your Kenyan hat, talk to us a bit about your direct concerns when it comes to the whole campaign of trying to tell people to actually observe hygiene, wash their hands. As Ben was mentioning here, that what will actually kill us is the level of ignorance. What is your concern when it comes to this?
Thanks, Eugene. I think I'm going to mention about 3 or 4. My one concern is we know that availability of water differs, and whilst we live in this city, I can open the tap and I find running water, but realize in other places that is not the case. And herein is a concern, and as a person, I think about what can be done. Of course, then hand sanitizer comes in handy. The second one, let me give you a personal perspective. I have my 2 domestic workers do not live in, they come and go in the evening. And at the early onset of Corona, I told one of my domestic workers that, hey, you've got to come and stay in, because I don't know what you're contracting when you go out there, and I've got kids. And I'm glad that she had that understanding. The other domestic worker, I told him, hey, hang on a second, because you've got to commute and come back, you cannot come into direct contact with my kids. So I stopped that 2 weeks ago. It took him a bit of time to understand, but now he totally appreciates that. But I think the level of understanding for me is then the concern. And in times when I've got to step out and you're seeing people are very cavalier about the seriousness of this disease, that really, really worries me. And the other thing that, of course, that I'm concerned about, when you think about areas where people are in high density living, especially the slums, where when we talk about social distancing, it is a rumor to them. And I'm just trying to wrap my head around that. I do not have any answers, but it is something that I leave every day worried and thinking about what could we do that is different. And then, of course, for me, then finally is it's a very difficult piece being able to tell your kids you cannot go to play out in the common areas that you were doing. But I think how I went about that is to sit them down, and my 3-year-old right now, when I ask her, do you know why we cannot go out? And she tells me, yes, Daddy, it's corona. She calls it coronavirus. But I think for me, that's the reality of being able to educate not just adults, but also kids who might not be able to fully understand this. Yeah.
If I had the powers in this world to pick you from where you're seated right now and drop you into the task force that is actually handling the management of this coronavirus, what sort of advice would you be giving them in dealing with the fear of dealing with the people in highly dense city populated areas?
I think one key thing is you need to be able to understand the context of these people. I think there's somebody I follow, and Gabriel Oguda, and he's an anthropologist. There's the people who study the virology of it who will be able to understand and say do this. But as an anthropologist, when you think about people living, say for example, in a slum setting, I think we need to be able to understand this really on a deep, because these are some of the most vulnerable people. Just to be able to understand in terms of this is a way of living, and how then are you still able to do the interventions to make sure that we minimize their exposure and their risk to corona, because we've seen what's happening the world over, and this is one of the things that we must be able to do. I also like the vibe that I'm hearing coming from the Ministry of Health when you talk about the disadvantaged. Or not just the disadvantaged, but the older people who are at higher risk. My grandmother is 98 years old. This year in April, we're going to celebrate, she's 99, she's going to be 100. Unfortunately, we've cancelled it. 100, the centenary is a big thing, but I think the other piece is to tell them, hang on a second, what are we able to do for people who are at a higher risk, to make sure that we are minimizing what's happening amongst them. So for me, those are two things that I would do. And the third is to say, I think the private sector as well as the public sector can be able to work really, really closely to make sure that we are minimizing the impact. I mean, this past week, I've been in conversations with some of our peers at companies like EABL and Unilever, where we're trying to say, guys, how do we come together as private sector and support and assist the government in making sure that hand in glove we're able to confront this issue that is facing the world globally, and it requires a moment of greatness or pulling down these barriers and working together.
And when I hear you say this, I'm wondering why you're not inside that particular task force. But anyway, let me bring in Brad on this one. Brad, from where you sit, I'm sure there are things that you're also concerned about. Tell me how you are also managing this with your team at where you work from. I've heard of cases where some companies have had to take a pay cut. You have from the CEO to the lowest paid member of that particular company. They've accepted to take pay cuts. Others have fired some of the employees temporarily or just told them to stay away from work, and paid leave and all those kind of things. From you where you sit, I mean, how has this affected you, and what have you been able to do as a small business from where you sit?
I think Eugene, as a hotel business or as a fish outlet, it's easier. Personally, it's easier to clean the surfaces and have the running water, because it's easier to manage. But the social distance part is where the problem is, because you cannot. It's very hard to tell people that wait, let the others finish. The place is now full. You can stand outside, wait the others to finish first. Is when you come in. It's really difficult to do that. But I'm happy. My customers are people who come on a daily, so maybe they understand. If you tell them like this place is small, you can stand outside and wait for the others to finish. Even after wiping the tables, we are not still safe. We have to wait for the others to finish. I think it's hard. It's hard on the social distance part, but we are managing as a team.
Apart from the social distancing being a challenge, your staffing? Have you had to tell some of your members of staff to stay away from work, receive a pay cut? Because probably now that you're not receiving as many clients as you are, then that means your income will be a bit, affected, and therefore you'd be in a difficult position to pay probably the people that you work with. How have you managed this, or how are you dealing with this?
As I said before, the coronavirus is a natural occurrence, so I wouldn't tell my workers that, now look, I'm going to give you a pay cut because of the virus. It's natural. So, but as the owner, I try so hard to, at least, but I give them their money. I don't have to cut because of the virus. It's affecting all of us, but plus we don't have like a bigger staff, so it's easier to manage. And most of the workers people paid on the evening, so it's really hard to cut their money, because the families they have calculated the salaries. They have calculated. It's really hard to tell someone, now look, I'm going to give you less salary because of this and that. You'll ask you, the worker will ask you, and how about my family? Because most of these workers, they don't really receive much money as salaries, so it's really hard to tell someone that I'm going to reduce your salary further because of this and that. So it's you as a boss, or it's you as the manager to contain the pressure. Though it's bad for business, but my workers, I think, I wouldn't recommend cutting their salary.
It must be a very difficult time, Dr. to actually be a manager or a leader of an institution. Let's debunk another myth or fact, depending on the kind of answer you'll give us, Dr. Ida. Some people are now worried. Where will they be able to have a clean cut? Are they going to be locked up in their house for a longest period of time? Me being one of them, as you can see, I've not done my hair as I would have wanted to because of that fear. I mean, is it safe to go to the salon? Is it safe to go to the barber shop? Is it safer to tell the barber shop, the barber owner to come and actually do your hair from your home, or the salonist to come do your hair from your home? What is safe for someone who's watching us and has that particular question nagging them?
Wow, it's a heavy question. And well, of course, I really empathize with all entrepreneurs, everyone who has a business, anybody in the informal sector. I mean, it is unfortunate that coronavirus came to us, but we have to deal with it somehow. So we have to deal with it. What is safe? Well, I don't know what I'd say. What is really safe? I mean, we have to just do the things that we're being told to do. I doubt you would be so affected if you didn't go to the barber. You can be shabby for a bit. I really.
So if they see us shabby, they should understand.
Yes, please.
And those with bad hair day, we should understand.
I suppose so. Yes.
Yeah. What if you say, probably if they came to your home, make sure there's a hand sanitizer at the door before you get in?
Exactly. If you can be able to afford that luxury of getting the service provider come to your space, then of course you have to go through the whole drill all over again. When you sanitize, hold the doorknob, sanitize, open the door, they enter, sanitize. Clean the surface where you will be doing the service, whether it is the salon or the barber. Finish, sanitize, or hand wash. So I think the drill just has to get inculcated into our minds, whether subconsciously or otherwise.
All right. Let's take a look at what the people we talked to earlier on had to say about the lessons that they are learning from where they sit or where they are. We were not able to go to the field to actually carry out these recordings, so we managed to receive these particular recordings via WhatsApp, and I want us to launch them and just take a look at what a section of Kenyans had to say about the lessons they're drawing from this whole coronavirus pandemic.
We take care of others by taking care of ourselves first. So if we self-quarantine, we take care of people around us. If we were infected, then tutakuwa prevent spread to them.
Yes, also there's a lot of misconceptions about COVID-19. I think it's important for people to ensure that the information they get is the correct information. If you don't know the right information about COVID-19, please dial *719. It's 719?
Yes.
Yes, or call 719. You'll be given the right information.
As a country, our government has put up measures to curb on the spread of the virus. As citizens, we have to follow on the measures. Already we've seen the extent of the effects of the virus in China, Italy. Kindly, let's not get there. And only if we follow on the measures that have been put in place.
Some basic things that we should do, like always keeping distance. It's not always about a virus or something being spread that we have to be told to do some things. We should always observe them even when this coronavirus is over. We should continue maintaining the same hygiene, the same manners.
Right, a section of Kenyans just sharing their thoughts on this particular issue. We still have more of them. We'll be unveiling them in the course of the program. Let's take a look at some of the tweets that have come in. I have one from @Busia Blogger who says, I am Osumo_Brad's customer, but since the outbreak, I have avoided the place and I am not accepting deliveries. No boom in business. This is exactly what he has to say. Brad, I'm sure you've been able to see this, and this is one of the people who says that they're taking precaution against this. For those who are still interested in actually still having this yummy fish, I mean, is this one of the decisions you're going to be taking and saying that, you know what, despite the fact that I need to earn a living and my staff have to earn a living, we are closing down and we are saying that we will be back when this whole pandemic is done with?
I think, Eugene, being a small entity or being a small setup, if it comes to that, I wouldn't really say, maybe if it comes to closing or if it gets serious than this, maybe we'd be forced to close. But as at now, I would recommend people to normalize the takeaways and deliveries because it minimizes the contact. Plus, there's so many food delivery apps there you can use, and Ampi Jumia is one of them, and Kenneth is here. He has also said that the measures that taken as a company, and I think maybe our customers should normalize the takeaways. They should be scared. I'll still even reach them. I'll still give them the fish. When they are at home, I'll send guys. I send the rider, the border guy, to bring them fish to their doorstep. They don't have to come to Big Fish for the fish.
And so probably, in your opinion, God forbid, we are told it's a total lockdown and there's no movements around, there's no doing deliveries and all that. I mean, share with us, just in perspective, how big this would be of an impact to you.
There's only one option. There's only one way. I will be forced to close down the shop because our customer. Most of our customers are people who have to come to the shop physically because it's a food outlet. It would be bad on my side or other business out there when it comes to that. When the total lockdown comes, it would be bad to every business because we'll be forced to close down the shop.
To hear some of the measures that different sectors have been called upon to be able to cushion, small businesses like yours and all that. What would be your clarion call? What would be your request for those in positions of influence to be able to still support people like you who would still want to be able to have or afford a meal on the table, but they cannot do it because of this pandemic?
Maybe I would ask the delivery companies, or maybe like maybe now Kenneth here, the Jumia ones, to at least maybe they reduce the delivery prices or something. Also, we could also reduce we could pay the have ones we could we maybe team up with the delivery people. We pay them up, so at least people more food reaches more people. I think that would be better because right now everybody depends on delivery. There's no any other thing. Everybody else depends on the delivery. So I would ask the companies that do the delivery, the food deliveries, to at least maybe cut down the prices, because even the Daktari has said it's only for a while. It's not going to take long. So yeah, cutting down the prices maybe would be better.
Kenneth, maybe let me bring you again on this one. I mean, this is the elephant in the room. Every time those live updates come or pop up on our phones or on our screens, some people sit on the edges of their chairs, worried about whether tonight or tomorrow or this particular update is the one that is going to bring us that breaking news that total shutdown is here with us and you're not allowed to move, and the people who are supposed to enforce that have been poured on the roads to do it. Would we be able to handle this from where you sit, Kenneth?
So, Eugene, thanks. I think from where I sit is one thing that the government is also telling people is, listen, let's not hoard. It's not about hoarding, but let us be reasonable. On the other side, companies like us at Jumia, we've been around for a long time, and about 8 years, like I've said, and we've perfected the delivery into people's doorstep. We are organized. What are some of the things that we have done? We've opened our logistics network and say that, hang on a second, today we've got Jumia Logistics, which you do not need to be necessarily a vendor on Jumia to be able to leverage our logistics, and we're talking to different people. We've actually spoken to the government and told them, hang on a second, we've got an excellent logistics network which is not just about the big cities, but we deliver deep down to the rural, where some of the disadvantaged people like the elderly live, and we want to make sure that we're going to keep the lights open. And we've got a system that is open to audit, whereby we're able to show, hang on a second, this is when this parcel came and this is where it went out. So we're going to work day and night to make sure that we keep the lights on. But in the unfortunate event that, say, a total lockdown is put in place, but I mean, people need to eat, Eugene. It's a case of finding out, we're going to make our best effort to make sure that we are still fulfilling the needs of our customers, which today has really moved on into essentials. If you need to see what people are buying, it is cooking oil, it is unga, it is beans, it's all of these things like diapers people are ordering there. So I think we're taking a very positive approach and engaging with the stakeholders to see how we can still be able to do all the things that people require in a lockdown situation in a very safe way that does not enhance the spread of COVID-19.
And let me bring it right here for Dr. Same question, Doctor. I mean, what is your worry? I mean, when it comes to this particular issue of the fear of a possibility of a total shutdown to actually contain the spread of this particular virus. First of all, as a doctor and also just as an ordinary Kenyan, how would we handle this?
Well, in the event that the government gives the directive that we go to a total lockdown, I want to believe that the government has the Kenyans' interest at heart. Mm-hmm. And so they will, if they give that directive, I want to believe that they will also give the necessary measures to be taken, bearing in mind that we are a third world country, bearing in mind that, a huge percentage of the Kenyans are in informal sector, bearing in mind that there are people who would actually live from hand to mouth. We have people in settlements like in the slums. So I want to believe that in the event that we go on a total lockdown, I want to trust our government, that it will be able to have directives on the way forward on this matter. I don't want to speculate because I'm a scientist, so I deal with facts. But that would be my standpoint.
Right. Yeah. And maybe while you're still at it, there's been this argument. People are saying, I mean, is it a matter of reducing the people within a specific area, or some people have sort of poured cold water on that, and they've argued that it is not a matter of the reduction of the people, but because even if it is 2 people people, one of them has it, it is possible for them to actually pass it on to the others. Just explain to us very briefly, just in a layman's language, how significant the issue of staying away out of the crowds is really significant.
Yes, so I think you're asking about the numbers in relation to social distancing.
Yes.
So we know that one person, according to studies that were done in Wuhan, China, because we have not done any studies here in Kenya yet, so I will just quote what has been done. It showed that the ratio of one person infecting other people without the social distancing is actually 1 to 2.2, meaning that one person can transmit this disease to 2 to 3 people at a time. So if you go multiplying that, 1 person to 3 people, 3 people to 9 people, 9 people like that. So I mean, it will be catastrophic. And so social distancing comes to, to come and mitigate that and try to reduce the number of infected, people who get infected or transmitted with the virus. And I mean, what we are actually talking about social distancing is stay at least 1 to 2 meters if you must be with that person. If you really have to be with that person, 1 to 2 meters away. Let's also avoid close contact. Let's avoid social gatherings. I mean, this cannot be overemphasized. Social gatherings, we can always do these gatherings after coronavirus has left us. Yeah? We can still enjoy our cake and weddings. We can enjoy our church services. We can enjoy our prayers at the mosque or the temple even after, So it's just a small inconvenience for a time.
Yeah.
And we are hoping that this will not last forever.
Yeah. For couples, let's talk about couples, because one of the couples is actually a person who's in and out of the house. Social distancing. How do they do it? How do they deliver this?
Actually, what I can say is, for a fact, I know that for the medical fraternity, we have actually, there are people who are actually quarantining themselves from their spouses.
Within the same house?
Yes, within the same house. Like, say maybe the husband is a doctor or the wife is a doctor and the other one isn't. So they're actually quarantining themselves because as a health professional, we are actually on the first line of contracting the disease one way or another as we are helping the patients. So, I mean, again, I will say this again and again, that it is just an inconvenience for a short time. Yeah, let's cooperate. Let's just cooperate with the government. I even know of people who are a couple and one traveled and came back and did not have the symptoms, but they quarantined themselves for 14 days, have done the test, it came out negative. Stories are there. And you'll be a couple for forever, or for as long as death comes in the middle. And so it's just an inconvenience for a short time, hopefully, so that we are able to combat this. I like the hashtag that Ministry of Health is using, #Komesha Corona. So let's do that. Kenyans, let's do that.
Yeah. Okay. But of course, there is also this particular concern when it comes to the issues to do with the tests. I mean, how is the test done? Where can I get that particular test? When they are doing this test, what are they checking? Is it just that temperature check when you go to visit some of the hospitals? We've seen them do it. When they allow you to pass, does that mean that you're negative? I mean, just also break it down to us, if you may, for that one.
All right, so the test that is being carried out is called a PCR test that is actually done for somebody who has the coronavirus scoring system of 5 and above. And the test, it entails getting a throat swab. So you actually get a swab of the throat and sometimes a lavage. So basically you just want to get something from the throat, yeah? And then you take that through the PCR testing. And then, of course, because we have fewer, for us from the medical perspective, that is our elephant in the room. The elephant in the room is we don't have enough testing for this. Right now we can only do this in 2 places. But I know that Ministry of Health and KEMRI are also broadening, they're bringing in more kits and more tests to do this. So, Ministry of Health is doing an amazing job and we are grateful. Yeah, we are grateful. So that's a test that is done. It's a PCR testing. You get a throat swab and then it goes through the PCR testing and then the results come out. whether positive or negative, and then we move forward.
Yeah. All right. Kenneth, I mean, you've been listening to Daktari, especially on that issue of self-quarantining within your own home, especially for those who are couples. I mean, earlier on you mentioned kids, and maybe you'll forgive me if it is not the same way at your house. But how are you dealing with this particular issue, especially for couples who have movements to do and have kids in the house? How easy or how difficult is it to actually keep this social distancing happening?
I think for me is if you realize the importance of keeping the kids safe, and that is not in doubt. So if you go to leave, or I've gotten an instance when I've had to leave, and I make sure I'm thoroughly self-quarantining, I'm thoroughly sanitizing before I come back in. And also, I'm very clear in terms of who I'm getting in contact with. So in this past week, a whole week, I only had 3 points of contact. And if you saw how I handled the 3 points of contact, is because we have agreed that the safety of the kids is really paramount. And as a result, what I don't have to do or what we don't have to do, we then don't do it. So I think just that agreement in understanding that, then that makes it makes all the difference in making sure that the home is safe. And I have a very militaristic approach to it. I'll say I have a cousin who, not a cousin, a niece who lives with me, and she'd not been in for a couple of days, and she walked in and she wanted to hug my daughter, and because my nanny is properly briefed, she told her, sorry, you cannot come in and you cannot hug my daughter, and that was it. She left upset, but later on I called her mom and explained, hey, this is what's happening. So for me, I'm not taking this any lightly, honestly, and I hope like other Kenyans are able to get this point of view.
I like the fact that you mentioned that you taking this really seriously, because in our families, I'm sure we have that relative who just takes things lightly, and they'll never take these things seriously. And of course, probably this is the best way to deal with them. Brad, how are you dealing with this within your own family? Self-quarantining, there is also that social distance. How are you dealing with this? What lessons has this taught you as far as handling your family is concerned?
I think it's a challenge to parents. I'm not a parent as at now, but I think it's a challenge to most parents, because at the end of the day, when you're from work or when you leave work, going to your house, the children will always be children. They'd love to jump on you, the daddy and mommy stuff. But what I would really encourage parents is before you get to your home or before you get to your child, you sanitize. You have to sanitize. Like maybe you wash your hands with the soap or everything. And I think maybe even if it's possible, maybe you change clothes or something. But sanitizing is important. But as a couple, really telling your partner like, oh, wait, now we have to maybe sleep on a separate beds or something, because I think what will help us is only sanitizing, because the bond will still be there. The child will still be the child. He or she would want to jump on the parent or something. But sanitizing before you go to your home would really help reduce cases, I think.
Look at another lesson, a clip from some of the Kenyans we spoke to via way of WhatsApp. But before we go there, very quickly, Daktari, there is that aspect of saying sanitizing, and we all love our mobile phones, and we've been sanitizing our hands, but the mobile phone, it's very rare to see someone sanitizing it. How do we do this? What's the risk that we are staring at as far as our mobile phones are concerned and this whole pandemic?
All right, so I mean, this is a very new phenomenon to most of us, except I think the only people who are having an amazing time are people who have OCD or people who are introverted, because for them it's pretty much natural to either stay at home, or if you have OCD of cleanliness, then that means you clean everything. But what I can just say is, let's just try, It's not natural, but it can be learned. Yeah, so let us try. So once you wash your hands, take the sanitizer and actually wipe your phone. Use an alcohol-based disinfectant to clean your surfaces, clean your car steering wheel, clean your surfaces, your tables, your doorknobs, anything that you know that you will touch. And then don't touch your face. Don't touch your face.
Really? How practical is this? Some people just find themselves touching their faces.
I mean, I understand. I mean, for example, myself, you can see I have glasses on, and so it's kind of natural to, want to, to push up my glasses, to position them. But it's just to, the more you do it, the more you get used to it. It's not natural. It is something new, and we are cognizant of that fact, but just try. Don't touch your eyes, don't touch your nose, your face, like that. So it's just try, and don't touch your mouth. I think it is MEN, mouth, eyes, and nose.
Don't touch men.
Don't touch men.
There you have it. We're going to take a very short break right now, and of course, as we do that, my team will definitely prepare another clip as far as the lessons are concerned. But of course, just let me read this one from agent wa Ozil, and he says this one sasa mtu ni wa bus, lakini anasema he is an Osumo brand customer, kamiti ya roho chafu. Huyu ni kama anaingilia ule mwenye amesema ni customer wa Osumo na hata rudi huko tena until the virus is gone for good. But of course, I want you to keep tweeting. Just tell us what thoughts you have over there. I have Kenzo's SK001 who says, Osumo, I like the way you are managing your business no matter the situation. Thank you very much. Keep those thoughts coming. All you need to do is just add the hashtag YouthConnect. We'll sample them when we come back. For now, let's take a short break. But of course, we'll be able to hear some more of the clips from the people who have shared their lessons out of this particular pandemic. Stay with us.
Peterson, tumefutwa wote.
Yawa, pia wewe?
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako?
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deeds pia. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today. Si nilikuambia.
You are a big smart joke.
Mwananchi Credit. Investor in people.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the Government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Ni jukwaa linalowapa vijana nafasi ya kuchangia kwa mada inayowaathiri.
Vijana tukishikana we can bring a revolution. Tunaweza geuza serikali sahihi, lakini
serikali yenyewe haiwezi kubali.
Tunazungumza kuhusu ajira, afya, uongozi, ukuzaji wa talanta pamoja na masuala ibuka katika jamii. Ni mazungumzo bora inayofungua mlango wa suluhisho kwa masuala tata miongoni mwa vijana. Ungana nami Paul Kirobi kila siku ya Jumatano kuanzia saa 12 hadi saa 1 jioni katika kipindi cha Vijana Mashinani. Wakati wetu ni sasa.
Right, we're about 15 minutes or so into 9 p.m. And of course, this is Youth Connect. We're just sampling some of the thoughts and views as far as lessons learned from this particular pandemic, that is coronavirus. Now, earlier on, we actually gathered some tweets from various people online on some of the lessons that they've been able to learn or what this particular pandemic has taught us. Let's now sample them right here. They should be appearing on your screen right now. Just one of them is from at Bill Nelly NBC. 3 things I have learned about the coronavirus crisis. Number 1, hospitals are not the front line in this war. You are. The medics treat the fallen. Number 2, the virus doesn't spread. You spread it. And number 3, there is no medical solution yet and maybe ever. You are the solution. This is what Bill says. Let's sample another one right there coming through your screens. And this should have been a reply right there and says, you know what I learned? That your average person, with rare exceptions, mostly fellow empaths, is selfish and doesn't care at all for their fellow man, which means we empaths who believe in love and kindness above all else have realized we are fighting a losing battle. This is what the conversation was over there. And let's just sample another one over there, and says that masks are the reason Japan, despite the world's oldest population, crowded conditions, and a high proportion of smokers, is getting through this without draconian shutdowns. This is what Eve has been saying over there, Sveta rather. Let's take a look at another one on the same particular thread, which says, never give up. Where there is life, there is hope. This is a lesson that at Tony Hendricks 1970 tweeted earlier on. Another one right there. It says, Corona has taught us important lessons in personal hygiene, in taking better care of the environment by not stepping out unnecessarily, in spending more time with family members, in focusing on health rather than hoarding money. I hope we remember these lessons even after Corona. Let's just take a look if there's one more right there. There you go. I think this one we've actually looked at it. That was the last tweet that we had sampled earlier on. And of course, these are some of the things that people have learned across the globe. And I want to bring in my panelists also right here. On a personal level, Dr. Ida, what have you learned other than just the medical area, but from a personal level, what lessons have you drawn from this?
I'd like to say that it is very unfortunate that we are having the coronavirus pandemic, but it is sort of a blessing to us because we did not have time for our families. We did not have time for our kids. We were not able to work from home, we are also learning about simple hygiene practices, Also, we need to stop being selfish, because if you go out there and you live as if coronavirus is in some other country, not in Kenya, I mean, that is being very selfish. And you will contract this virus and then just continue with the transmission to other people. So let's not be selfish. And above all, do not fear. Do not fear. Let's have hope. And let's work together as Kenyans. Kenyans, please, let's work together. Let's work together with the Ministry of Health, with the government, follow instructions, follow those simple 5 steps, 1, hand washing. 2, supplement with sanitization. 3, avoid close contact. 4, clean all your surfaces with an alcohol-based disinfectant. 5, avoid social spaces and encourage social distancing. You know, and one last thing: just because we are staying at home or working from home does not mean you cannot talk to other people. You know, because there's also it's on a tight balance that we can be at home, especially for the extroverted people, and then we tip over into depression. So staying at home does not mean that you don't talk to people. Call up people. I like what Safaricom has done, has even cut down some M-Pesa transactions. I mean, public sector, private sector, we are all working together. So talk to people, have Skype, Zoom, you know, WhatsApp, you know, conversations, and time yourself. If you're working from home, have a schedule, you know, plan like you're working from this time to this time, have timed breaks, you know, and also get time to bond with your family, bond with your kids. I mean, coronavirus is such a blessing in disguise. Marriages, I mean, from a personal perspective, let marriages flourish by people being in one space.
Being in one space. There's a joke in some of the countries that actually there's been a higher rate of divorce because these people never even spent more time together, and now they're like, okay, so this is the real you because I've really spent more time because of this whole quarantine thing. Kenneth, what lessons have you learned? Typically, do you also believe this is a blessing in disguise?
Thanks, Eugene. I think for me, number one is family. Not that I've not been big on family, but I think it's gone to another level of getting on to really appreciate spending time with family, and that for me has been great. I mean, I showered to come for the show. I've been in pajamas, and if you look at my Twitter feed, I've got stickers all over my face, which my daughters are putting on, and we had an awesome time. I think that's one. Number two is technology. I've always been switched on technology, but I've had a really deep appreciation of technology. In the past, I would tell people, why don't you do a video call? Even when I'm doing a personal call, they go like, come on, let's do phone. But now just being able to do that and leverage it, speaking to different people, it's almost like telepresence. I think I really appreciate that. I appreciate things like home delivery because it saves me time, and I've really appreciated when I can't be able to cook to be able to order stuff. I think that I've really appreciated. And also, I've learned where my baking pans are. You know, just getting on to do things with the kids and then family. So today, I realized one of my baking pans had given to somebody, and I had to send a rider to bring the baking pan, and because we were making some cake. So I've really learned to appreciate a number of those things. And I think the other thing for me from a learning is it takes quite a while when it comes to dealing with people and humans to get them to be on the same wavelength. And for me, it's the whole piece about patience. My patience has been tried seeing people and how people are behaving and not realizing, hey, you need to be a little bit more safe. So on a personal level, those are some of the things that I've learned. One last one, if I think about on a business level, the one thing that I've also learned is the flexibility and the agility that businesses have switched on when things like something like Corona has come. Who would ever have thought that X%, I don't know how many people are working out there, but you're able to see it as far as then the internet speeds are impacted because people are at home. I think the belief that people need to be very agile and switch on, and I don't think things are ever going to be resetting after Corona is over because in some instances it's been proved that you can be able to do quite a lot of work from home. It has been proven that, hey, hang on a second, online business works, and I don't think things are going to be the same again after this.
There's been a total disruption in the way we even think about work. This is the time that now people will be saying, why is it that I have to always, when I get to the office, I must clock in on that biometrics that I arrived at work at 6 a.m. So that I'm able to work. So people will be able to look at this differently, you believe?
if you ask me, I think a couple of things are going to change in terms of how people work. I think I saw a tweet somewhere where you say that, hang on a second, after this, do you really need all that office space? And here I'm kind of just talking generally from as a Kenyan, because a lot more has been done. Of course, that also comes with the discipline that you require. Not everybody is in the same place as far as discipline. For example, I do a check-in call with my teams at 9 o'clock in the morning. We all jump on a Google chat and check in on everybody. Are you healthy? Do you have anything? What are the key things that you're focusing on? And then we go chasing that and check in back again. But I think a lot of things are going to be different. Just double clicking one now that representing Jume. If you look the world over, the impact on e-commerce business has been, if you ask for me, on the positive, and this is one of the things as I see going to happen as far as once people get on into the habit, then it's something that's going to grow and settle at a new level.
Brad, for you, what are you praising coronavirus for?
I think coronavirus has taught me to appreciate life, to appreciate good health, because I'm imagining those people, the people with the low immunity, or the people, how they survive on a daily, like they wash their hands or something because of the immunity. Right now, it's only been 2 weeks here in Kenya, but people are really scared, and I've learned that being on a good health is important, because if I see how we are managing, or how we are really behaving now as opposed to before, I think there's a change in that. And also I always see my mother wash her hands like every other time. I'm like, Mom, mbona unaosha mkono saa yote? And like, she has to be clean. Or sometimes I think she's selfish, but now I'm coming to understand that we should really appreciate good health. When your immune system is okay, or when you're in a good shape, you should really appreciate.
That's very interesting indeed. I mean, we need to appreciate life. Let's take a look now at the final installment of the set of videos that were sent to us via WhatsApp by a cross-section of Kenyans who talked to us about what lessons they've learned from this whole coronavirus.
Hello guys, I'm Peter Silas Anangwe. I just want to talk something small about the COVID-19, the coronavirus. We know that this is a deadly disease and it's very dangerous, and it spreads very fast. So like, we should take the necessary precaution as we are being given from the Ministry of Health. We should wash our hands and avoid unnecessary gatherings. Thank you.
Hi guys, I'm Jesse. As we all know, our country, our continent, our world, we are going through this COVID-19, and things are not seeming very well as per the news that we are receiving. Okay, what we have learned, this is not an ordinary cold. It's more like a severe pneumonia, from the information that you're getting. And I would like to urge people, especially Kenyans, don't take this lightly. Take the necessary precautions our government is giving us. Social distances, partying, try to avoid such. And also, I'd like to urge our government, things are not seeming very well. People are being laid off from work, no way to survive. We need your support. No way to pay rent. I don't know what will happen. I'd like to urge you, help us out. And also, don't take this lightly, that the disease also is difficult for the elderly. It also affects the young or the youth. As there's a case you have just seen, a 44-year-old DJ from Ohio, if I'm not wrong, has succumbed to the coronavirus. I think 44 is a very young age, so we cannot take this lightly. Young people, stay vigilant. Keep your elder ones, your dear ones safe. Don't bring them to any risk.
I know if these cases escalate, I really don't know what's going to happen. I really can't imagine how we are going to deal, because at the forefront, and this brings us back to the issues of health that we are discussing. We devolved health, but even up to now, we do not have ICU centers in most of, I mean, in the deepest, the smallest units of fully fledged hospitals within the counties. I think this is a wake-up call as a nation, that we have let corruption just eat away our health system to the mere fact that we're not able to control this. If you look at Germany, Germany is doing quite well because despite them having the numbers of infections, the numbers of deaths are still very low, because these are places where health is taken so seriously. Guys are not joking around with the health system. And Kenya, we are so blessed that we have so much so much training and capacity in terms of personnel. But the sad part of this nation is that we cannot be able to fight this off simply because we have eaten away our resources.
Hello, my name is Carol. I'm a banker by profession. I would say Corona we've not received the full impact of Corona, but as of now, what I'm learning from the situation is first, we need to cultivate the culture of saving. Right now, everyone is rushing to buy things in anticipation of lockdown, and I believe and I feel that we have not nurtured the culture of saving. So we need to be saving as much as we can. My second lesson from Corona, I would say, is trusting in God, going back to God, believing in God, because there is so much relation with what is in the Bible and what is happening currently, and I believe and I trust that God is angry with us and He needs us back to Him. So we need to learn to trust in God. We need to learn to depend on God.
Right, interesting lessons being shared right there, of course, which actually brings us to one of the other news items that we actually saw earlier on in the day. And there was this particular announcement that was made by US President Donald Trump during one of the briefings to the people of the United States and the rest of the world. Let's take a look at it, and then we come back to very briefly talk a bit about it.
A drug called chloroquine, and some people would add to it hydroxychloroquine. So chloroquine or hydroxychloroquine. Now this is a common malaria drug. It's also a drug used for strong arthritis. Somebody has pretty serious arthritis. Also uses this in a somewhat different form. But it is known as a malaria drug, and it's been around for a long time, and it's very powerful. But the nice part is it's been around for a long time. So we know that if things don't go as planned, it's not going to kill anybody. When you go with a brand new drug, you don't know that that's going to happen. You have to see, and you have to go long test. But this has been used in different forms, very powerful drug in different forms. And it's shown very encouraging, very, very encouraging early results. And we're going to be able to make that drug available almost immediately. And that's where the FDA has been so great. They've gone through the approval process. It's been approved, and they did it. They took it down from many, many months to immediate. So we're going to be able to make that drug available by prescription or states. I spoke with Governor Cuomo about it at great length last night, and he wants to be right on the. He wants to be first on line, and so I think that's there's tremendous promise based on the results and other tests. There's tremendous promise, and normally the FDA would take a long time to approve something like that, and it was approved very, very quickly, and it's now approved by prescription. Individual states will handle it. They can handle it. Doctors will handle it, and I think it's going to be. I think it's going to be great. Then we're.
Now there you have it, President Donald Trump, right there. Dr. Harry, is this good news that the world has been waiting for? Chloroquine as part of the drugs that can actually treat coronavirus.
So I'd like to state that coronavirus does not have a cure yet. And there are only, well, I think there are some studies that have been done, but nothing has been clearly documented. But I'd like to say that, of course, there's a relationship within the pharmacology of chloroquine and hydroxychloroquine with the virus, but we don't have those tests here in Kenya. This is a very new virus. It's only been with us 4 months, yeah? So, I mean, Kenyans, stop panicking, please. Please, Kenyans, please. Stop no panicking. Stop going to the chemists to order for yourself chloroquine. I mean, that's so selfish, you know? And number one, chloroquine is not an OTC. It's not an over-the-counter drug. Number two, it has so many side effects that that drug should only be prescribed by a medical practitioner. So please don't prescribe for yourself. Don't be kimbelembele. If you just do, I mean, we want to stay at the preventive stage. We don't want to move over to the treatment modalities, yeah? Because prevention is better than cure. So right now we don't have any known cure for coronavirus. And I want to say that very clearly. And so please don't get into the panic of going to the chemist to buy chloroquine or hydroxychloroquine, because these are drugs that are strictly prescribed.
Strictly prescribed. Someone would be wondering and saying, at what stage, at what level should we wait as Kenyans to be told that finally it is here, when the US president is saying that there is actually a level of, working of this particular drug on this particular virus?
Yes. So let's not follow. You see, when medical scientists are doing tests, yeah, they do for a couple of people. So there's a Caucasians, there's a white people, and there's a black people. And the three category of people actually react differently to a different drug. And so I want to categorically repeat and say that no tests, no experimental trials have been conducted on blacks to verify that chloroquine or hydroxychloroquine is actually a cure for coronavirus.
Right. Kenneth, when you heard that particular statement from Donald Trump, did it make you feel like finally we are on the right step, we're on the right direction to finding a solution to this, or you're still feeling like we still need to wait until when we're told this is it and it is working for us as a people of Kenya?
Eugene, I would, much as my background training is as a scientist, but I would be so out of my depth to comment on what the United States president would say. What I know, however, is, and what I'm doing and what we're doing at Jumia is we're focusing on making sure that we're making hand sanitizers available at affordable prices. And the science also says not just about hand sanitizers, but soaps. And we are making sure that the basic essentials as soaps are also available, face masks, and all these things that go towards prevention. And that's where I stand at now. But I'll be so out of depth to comment on that statement.
Osumo, probably your closing remarks, lessons. Where do we go from here? What do we do from here as we close this particular?
I think from here or from tomorrow, we should just wait for official announcement from the government. We shouldn't be scared. Penye tu daktari amesema, we shouldn't be scared, or maybe run to some funny ways, like getting the chloroform and something, the chloroquine and something. We should wait for anything now. Anything we do should be strictly from the government, from any official announcement from the government is what we are supposed to depend on. We shouldn't also depend on some hearsay or chloroquine or something. Or I think right now we are dependent on the government. Any official statement from the government, it would help a lot. It would save us.
Thank you very much. I'm told we are running out of time, but just very quickly, let me read this one from Keith, who says, I think Kenya deserves these so-felt draconian and punitive measures. I saw CS Kagwe looking furious, and understandably so. Why were people clubbing yesterday night, going to church today? Crowded matatus, Kenyans, do we need to be policed to be logical? This is definitely what